want. And I'd say, I would expand it a little bit, not just in terms of musculoskeletal conditions, but also talking about conservative versus surgery. I think maybe one of the lesser, maybe counterintuitive, lesser known benefits of physical therapy is that it can also be used to address surgical injuries. So I think people, even with ACL tears early on, right? A lot of it is still them doing the work from a range of motion perspective. And even in the prescribing the exercise, I think you can still be effective with doing it online. So I think even with some surgery cases, some shoulder surgeries, not necessarily a rotator cuff tear, but maybe some subacromial impingement surgeries. I think there can be a case made that not just conservative management, not just non-surgical cases, but also surgical cases can be treated effectively with telehealth or online physical therapy.
Absolutely. You definitely bring up a good point, especially with some examples of, say, ACL or even total knee reconstructions, total hip reconstructions. Honestly, even in-person therapy for those type of surgical cases, they're all exercise based. So very rarely in any of those do you need manual unless there's some type of restriction that you need to work out. But by and large, those are exercise based and active approach recoveries. And especially with the active population, ACL injuries tend to happen in that mid to late 20s because they're sending it on the slopes where you're at or where I'm at here in Salt Lake, and they might be living by themselves. So if they have a surgical case, they have an ACL tear, now they can't drive. That could be another barrier. And like you mentioned, with those specific surgical cases, telehealth is again the answer. They don't have to drive anywhere, and you can still walk them through, because with all those surgeries, the total knees, total hips, ACLs, honestly, it's the first 4 to 6 weeks you're almost trying to do damage mitigation and prevent them from re-injuring things while strengthening up and stabilizing things along the way to get the best long-term outcomes.